Hi friends, how are you all? I'm very good, Andy. Abortion. Abortion. What is abortion? Abortion is the termination of pregnancy by the expulsion or removal of the embryo or the fetus from the womb is called as abortion. Okay, welcome to my channel, Shruthi Nursing Officer. Please like the video, share to your family and friends, and please subscribe to my channel, Shruthi Nursing Officer. As you know, today's topic is about the abortion. Okay, what is this abortion? As I said you already, abortion is a termination of pregnancy. Termination means the end of the pregnancy, whether expulsion of the embryo or the fetus from the womb is called as the abortion. Normally the abortion occurs in the viable period. That viable period is about 20 weeks. Okay, within 20 weeks the abortion can take place at any time. Okay, without any medical interventions, if the fetus is expulsed outside, means is called as miscarriage. Okay, miscarriage, the name only indicates when you are carrying, you are pregnant. Okay, that carrying embryo which is present in your uterus is missing, means it is expulsing outside, is called as the miscarriage. Okay, then here, what are the causes of the abortion? As you know, the abortion can happen at any time within the 20 weeks, right? So it is because of any chromosomal abnormalities. Okay, chromosomal abnormality means it completely comes under the genetics. Okay, we don't want to go deep into the genetics, just it is think that, or you need to know about the one of the causes, chromosomal abnormalities. Okay, what is the second one? But in the chromosomal abnormalities, in about 50% of the abortions are because of the chromosomal abnormalities, whether it is are the extra adding of chromosomes or the missing of chromosomes. Okay, so this is the one cause. Second cause is the maternal health condition. What is the maternal? Maternal is the mother or the woman who is carrying the baby or who is pregnant. What are those maternal conditions? First one is the uncontrolled diabetes mellitus. As I said you already, in case of uncontrolled diabetes mellitus, we are going to know the insulin resistance. Then in these cases, the formation of the proper placenta won't be takes place, which can leads to the uncontrolled diabetes mellitus. What is the second one? Any infections. Infections means sexually transmitted infections or the reproductive infections, which can leads to the second maternal health condition. What is the third one in that? The hormonal problems. As I said you already, the ovary, when the ovum is formed, the rupture follicle is called as corpus luteum. This corpus luteum is unable to maintain the progesterone level. This progesterone level helps in the thickening the lining of the endometrium. So when this progesterone hormone is not properly took place, what happens? There will be a abortion takes place. There is chances of abortion. Then in uterus or the cervix problems, uterine fibroid or any cysts or polyps which are present in the uterus and the cervix can leads to the abortion. Then thyroid diseases. As you I think you heard that the thyroid, which is a main hormone which helps in the iodine metabolism, right? So in case of thyroid patients, they can conceive, but it's very tough to maintain the pregnancy. Okay, it's not at all tough. If they are maintaining the proper medication with the help of the obstetrician, they can continue the pregnancy. If it is not controlled and untreated in the thyroid diseases, there may be a chances of the abortion. Okay, the next one is the excessive intensive activities. After conceiving, if the woman is going to do the intensive exercises, highly intensive exercises, there may be a chances of losing the pregnancy. Then what is this? The exposing to hormones or the chemicals and the radiations. Chemicals and the radiations means in case of those who are suffering mainly with the cancer, they have to undergo the radiation and the chemotherapy. In these cases, there may be chances of getting the abortions. Okay, then these are the main two causes. What are those? Maternal conditions and the chromosomal. When comes to the chromosome, 50% of the abortions can be takes place because of the excessive or the less chromosomes, and all these are the maternal conditions. Then what are the signs and symptoms of abortion? How can you know the miscarriage has happened? Means most of the miscarriages occur before the 12th week of pregnancy. Okay, 12th weeks means within 3 months only they used to get the this miscarriages. Okay, next one is the vaginal spotting or the bleeding. How we can know about this abortion? Means if she is undergoing the miscarriage, there will be a bleeding in the vagina, spotting or the bleeding in the vagina. Next, pain and cramping in your lower back. Okay, cramping pain, the severe pain will be there in the lower back, and you will be having the fluid or tissue passing through the vagina. Okay, get the monthly menstruation, like that you will be getting there will be clots present in the bleeding. Okay, most of the miscarriages happens, they don't know whether they are pregnant or not. Okay, in the time only so much of the miscarriages are occurring. Okay, so these are the signs and symptoms. By these ways you can know the whether she is carrying or miscarrying. Okay, what are the risk factors for abortion? Okay, some of the risk factors we have. Okay, all the women won't get the miscarriages, but in these cases the what I am going to explain you, those are the risk factors. Okay, what is the risk factors? Age is very important. So only all used to tell the high, sorry, elderly primate means the woman who is pregnant after the 30 years, but she is carrying for the first time, she is also a one of the high risk pregnancy. We'll call it as a high risk pregnancy. So age, when the woman got pregnant more than 35 years of, the 20% risk will be there. Okay, the risk is about 20%. If the woman is more than 40 years, the risk of miscarriage is 40%, and if the woman is more than 45 years, the risk is 80%. Because here when 45, when the woman comes to the age of 40 to 45, what happens? That is the menopausal period. Okay, during this time there may be a lot of hormonal changes takes place in the women body. Okay, so as the age increases, risk of the abortion going to increase by increasing. Okay, so next one is the previous miscarriage. Those who are having the previous miscarriages, they have undergone the dilatation and curettage process, they are also prone to get a miscarriages in the next pregnancy. Next one is the chronic conditions. What are the chronic conditions? I already told you, uncontrolled diabetes mellitus, thyroid diseases and all. Okay, next, uterine or the cervical problems. Okay, so here weak cervical tissue. Okay, why? Because here the cervix plays very important role in maintaining the pregnancy. Means if the muscles of the cervix is good only, then it can lead to the good pregnancy. If the muscles are weak, what happens? The cervical os is going to open, and the release of the conceptional products in the uterus is going to expelled out. Okay, this one. Next one is the smoking, alcohol and drug addict. Okay, so here smoking, alcohol and drug addiction can cause the risk factor for abortion. Okay, so next one is the weight. As I said you already, always try to maintain your health. Ma'am, you are telling to maintain weight, and also you are telling that please maintain your lifestyle like that. Okay, if you want more about the lifestyle and the weight management, please call to this number which is displaying in the screen. Okay, the ma'am can explain you about the weight management and your lifestyle modification. Okay, if you are suffering with any thyroid, PCOD, PCOS, any hormonal imbalances or related to the mental conditions, so you can contact the ma'am number, and it's displaying in the, I'll give you in the description box also, and it is displaying in the screen. Please contact to this number. Okay. So next one is the weight. Weight means not only the overweight, underweight also. Okay. If the woman is overweight, what happens? The hormonal changes is going to take place. Then if the mother is less weight, means unable to meet the nutritional aspects of the baby, so which can leads to the miscarriage or the preterm labor. Okay. So these are the risk factors for abortion. Then what are the complications of pregnancy? What are the complications means the women who miscarry develop the infections. Okay. Here the so many, in some of the women, if they are not properly treated, what happens, they can end up with the miscarriages, can end up with the infections, which called as the septic abortion. Okay. So why? Because here we are, if they are not properly maintaining the personal hygiene, which can leads to the infection, those infectional abortion is called as septic abortion. Okay. Then what are the signs and symptoms of septic miscarriages? Okay. Here, if the mother is undergone septic abortions, the sign, some of the signs and symptoms she used to get. What are those? First one is the fever. Okay. Main signs and symptom of infection is fever. If you are getting a fever, means some of the infection is present in your body, so only we'll do the CBC WBC count in the this blood tests. Okay. So first one is the fever, second one you will get the chills. Okay. Chills along with the fever. Then lower abdominal tenderness. Okay. In the lower abdomen you feel, if you touch also you will feel a pain, that is called as tenderness. Okay. Low abdominal tenderness will be there, along with the foul smelling vaginal discharge will be there. Okay. Foul smelling, the vaginal discharge you are getting now, that whether it is watery discharge or the white discharge or the any conception products of the conception is expelling, those are having the very foul smell. You can't bear the smell of that discharges. Okay. These are the signs and symptoms. Then how you can prevent the abortions, how you can avoid the abortions, means mainly focus on your lifestyle. Okay. Mainly focus on your lifestyle and take care of yourself. When you take care of your body will take care of you. Always keep in a mind, when you take care of your health or the body or the mind properly, it will take care of you. Okay. First keep in mind that. Then seek regular prenatal care. What is the prenatal means? Before the pregnancy. Okay. If a particular person underwent a regular miscarriages, okay, one by one, please try to maintain the prenatal care by the obstetrician. What the obstetrician says, try to maintain that. Okay. So next one is the avoid smoking, drinking and the alcohol, because alcohol, smoking, those are the very dangerous factors which affecting mostly the abortions. Then take daily multivitamins. Okay. Multivitamin. Okay. What are these multivitamins? We have the so many multivitamins which are available in the medical shops, but you want to take the healthy medications, as I said you already, the displaying number has to be displaying number is there na, please contact her, she will tell about the multivitamins also, which are the good multivitamins and how she can help you in maintaining your lifestyle, and the diet modification also for maintaining. Even she helps you for the overweight or the underweight. Okay. Please contact her. Next one is the limit your caffeine intake, is very important. Those who are very addicted to having the coffees. Okay. So try to maintain your caffeine intake, which is also responsible for the abortions. Okay. Clear with the topic? Okay. These are the what is the abortion, what are the causes of abortion, what are the risk factors, and what are the signs and symptoms, and you can prevent. Okay, this is about the abortion. Okay, please like the topic and share to your family and friends, and do subscribe to my channel. Thank you. Next topic will be on repeated abortions. Okay, bye bye, take care.